So this new arm is called the Technomount. What we had in the past is our monitor would be sitting right beside us. The concern that we had is when we were trying to use any of our cables, and I'll show you in the older unit exactly what it looked like. Our heart monitor cables, we have our blood pressure cuff and our SpO2 monitor. Everything's in the way. So if I actually need to get to the practitioner chair or move back and forth to get equipment, I need to grab onto handles and take a large leap over. And mind you, this is all being done while we're driving down the road.
We had a team that traveled to multiple communities in all 5 zones from border to border across the province, and they participated in simulated scenarios on a closed driving track in a moving ambulance with a human patient simulator where they worked through a clinical scenario providing medical treatment, and utilizing cameras and microphones, we were able to monitor and evaluate.
We've actually turned this cabinet sideways. In the past, the practitioner would actually have to get up from their chair, and you can already see I have a 3-point position here, but you'd have to step over and you have to access the door in this position.
There's a safety hazard design associated with cables, tubing, blood pressure cuffs. All that stuff gets in the way of the paramedic moving around the patient to deliver care. And that's a fundamental safety problem. And in the new ambulance, you see the life pack is up on top of the stretcher itself, which is a wonderfully great design to sort of take away that hazard.
We were able to take a team of academics and a team of EMS professionals and bring them together to study a problem in EMS. And I think that's a huge benefit for both the patient and the paramedic. And it really demonstrates the value of research and having research embedded within our organization.
Paramedics very much want to take care of the patient in the back and deliver care, and they'll sometimes sacrifice their own safety to do that. And so what the redesign of the ambulance itself allows you to get around that problem, which is a good thing. So now they don't have to do it, now they're safer, and care can be delivered, and the providers can keep on in their jobs doing their stuff.
Together, we do amazing things every day.